Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Mujahid Buneri. Welcome to the channel Dr. Mujahid Buneri. I am here to make hard medical concept easier for all healthcare professionals and students. Today I will discuss a very interesting topic, febrile seizures. The objectives of my today lecture includes number 1, what is febrile seizure? Number 2, what are the clinical features of febrile seizure? Number 3, what are the causes of febrile seizure? Number 4, how will you manage a patient presenting with febrile seizure? Number 5, how will you counsel the parents or caregivers? Number 6, what is the prognosis of febrile seizure? As usual, at the end of the lecture, I will ask 3 questions regarding febrile seizure. You can search the answers and give your answers in the comment section. So let's start. What is febrile seizure? First, what is seizure? Seizure is the motor, sensory, or psychomotor manifestation of abnormal electrical activity in brain. What is convulsion? The motor manifestation of abnormal electrical activity in brain is called convulsion. This is the real difference between seizure and convulsion. In fact, febrile seizure is convulsions in pediatric age group from 6 months up to 5 years of age associated with fever but without any serious underlying health issue. When there is no serious cause like meningitis, encephalitis, epilepsy, etc., for seizures, and the only cause is elevated temperature, it will be called febrile seizure. It is also known as fever fit or febrile convulsion. Febrile seizures lasts for less than 5 minutes of duration. The seizures are usually tonic clonic type. It means first the patient will become rigid and then jerky movements start. Okay. What are the clinical features of febrile seizure? It includes number 1. Most febrile seizures occur during the first 24 hours of developing fever. Number 2. Temperature will be more than 100.4 degree Fahrenheit. Number 3. Fever is followed by tonic-clonic seizure. Number 4. There is loss of consciousness during febrile seizure. Number 5. There may be open eyes which will be deviated to one side. Number 6. There may be bowel or urinary incontinence during seizure. Okay. What are the causes of febrile seizure? Before coming to the causes, first, what is the mechanism of febrile seizure? How it occurs? The exact mechanism is not known, but in majority of cases, family history is positive. So there will be definitely some association with genetics, but it is not well known up till now. Causes of febrile seizures include illnesses in children that cause fever, For example, viral infections of upper respiratory tract, middle ear infections, etc. In short, the only cause for febrile seizure is fever. That's why the name febrile seizure is given. Okay, how will you manage the patient of febrile seizure? Number 1, you will take detailed history. Number 2, you will do relevant examination. Number 3, you will advise certain investigations to exclude other causes of seizures. It includes number 1, lumbar puncture and cerebrospinal fluid routine examination to rule out any CNS infections such as meningitis, encephalitis, etc. Number 2, you will advise metabolic profile to rule out metabolic causes of seizures. Now, coming to the treatment, it includes number 1, antipyretics such as paracetamol, etc., and cold sponging to lower the temperature. Number 2, anticonvulsants such as IV intravenous diazepam or lorazepam or phenobarbital for seizures. Number 3, you may give antibiotics for infections. Number 4, counseling and reassurance of parents. Okay. How will you counsel the parents? Number 1, counsel the parents about the cause of fits such as fever and the nature of disease. Number 2, counsel the parents that the fits may occur till 5 years of age. Whenever the child has high grade fever, give oral antipyretics and other measures such as cold sponging in order to lower the temperature. Number 3, make sure that diazepam is available at home and give per rectal in case of fits, or you can also give lorazepam nasal spray 2 puffs intranasally during fits. Okay. What is the prognosis? Number 1, prognosis is good. Number 2, recurrence rate of febrile seizure is 50%. Number 3, when no risk factors like central nervous system defect is present, then chances of epilepsy are 1%. Number 3, when risk factors are present, the chances of epilepsy are 9%. Coming to today's questions. Number 1, what is the difference between seizure and epilepsy? Number 2, is there any difference in occurrence of febrile seizure regarding sex of patient? And the last question is brain imaging like CT or MRI necessary for routine diagnosis of febrile seizure? That's all about today's lecture. Thanks for watching the video.